You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 20-year-old young man was involved in a football match, during the dry season of the year. Unfortunately, during the football match, the opponent hits the right side of his nose, with his head, and in no time, he started bleeding through his, right anterior nasal aperture, or simply the right, nostril. Immediately, he was, attended to by the first aid team, and they did some activities trying to, stop the blood coming through the nose. Then later was sent to the hospital because the initial, management by way of the first aid didn't really, resolve the issue. Now, laboratory investigation, in the hospital revealed that this individual has low platelet count. So this is the case study that we have before us, and then we have some questions to go through this. Now, the first thing is that, yes, this patient was bleeding through, of course, the right, nostril, So what is the medical or the clinical term for one bleeding through the nose? And my friends, your answer that I want you to give wherever you find yourself, if you have anything like that, is epistaxis. That is bleeding through the nose. That is epistaxis. So that's the first question that we have. Now, the second question is that this portion of the nose that this individual was bleeding from is actually something we call the littles area, of the nasal septum. So now the question for us is that what are the components of this nasal septum? And my friends, your answer, the main components, we have three of them. The first one is that we are going to have, superiorly, we are going to have what we call the perpendicular plate of the ethmoid bone. That's number one. Number two, the inferior bone, which is going to meet the perpendicular plate of the ethmoid bone, is the vomer. And number three, in the living, it will be reinforced by something called the septal cartilage. So number three is the septal cartilage, which of course is made of hyaline cartilage. So these are the three components of the nasal septum. Now understand again that I said that the area where the bleeding came from is actually what we call the littles area. Now, what is over there in the littles area is, my friend, something we call the Kieselbeck's plexus. Kieselbeck's plexus. And this Kieselbeck's plexus, yes, we have that kind of rich, anastomotic connection of some, arteries. And so the question for us is that what are the contributing arteries to this Kieselbeck's plexus in, of course, the littles area? So the answer for you is that yes, it could be 4 or it could be 5 arteries, and I'm going to explain why. So it means that the fifth one may or may not, partake in this, anastomosis that we find in, of course, the littles area. So what are these components? The first one that we talk about is what we call the anterior ethmoidal artery. So in the littles area, where we see it located in the anteroinferior portion of the nasal septum, the first component that is going to contribute to this rich anastomotic connection is what we call the anterior ethmoidal artery. Understand that this anterior ethmoidal artery will be coming actually from what we call ophthalmic artery. And we know that the ophthalmic artery comes from what we call the internal carotid artery. So the first thing I want you to know is that we have what we call anterior ethmoidal artery, a constant contribution to this Kieselbeck's plexus. Now, number 2 is called the sphenopalatine artery. Sphenopalatine artery. Understand that this sphenopalatine artery is the terminal branch of what we call the maxillary artery. And of course, we know that this maxillary artery actually comes from what we call the external carotid artery. So number 2 is what we call the sphenopalatine artery. Now the third contributing guy is what we call the greater palatine artery. Greater palatine artery. And also understand that this greater palatine artery is also a branch of this maxillary artery, which we've talked about. Now number 4, which is also a constant contribution, is, my friend, something that we call the superior labial artery. Superior labial artery. Understand that the superior labial artery actually comes from what we call the facial artery. Actually, the facial branch or the facial part actually of the facial artery will give what we call the superior labial artery. Also a constant contribution to, of course, this Kieselbeck's plexus in the litmus area. Now the fifth contribution, which may not contribute at some point in time, is, my friends, what we call the posterior ethmoidal artery. And as we said for anterior ethmoidal artery, posterior ethmoidal artery will also be a branch of what we call the ophthalmic artery. So understand that when we look at, broadly speaking, the litmus area where we have the rich anastomotic connection, by what we call the Kieselbeck's plexus, we'll be having contributions largely from what we call the external branch of the external carotid artery. Yes, that is the main thing that we are going to see, called maxillary, and of course the facial artery. And then also the internal carotid artery may also contribute, to some extent, by way of giving, from branches from what we call the ophthalmic artery, giving what we call anterior ethmoidal artery, and sometimes also the posterior ethmoidal artery also contributing to the Kieselbeck's plexus. So that's the one thing that I need you to know. And that is why whenever there's that kind of direct trauma, so in this case, the person's head hits that side of the nose, so it means that it's going to cause some kind of rupture of some of these vessels, and that will result in that bleeding, which we are talking about as epistaxis. Now the next question for us, is for us to look at, what we call the risk factors. We want to look at the risk factors. What are the things which will predispose, or what are the causes, so to speak, one getting this kind of epistaxis? And my friends, we know already, we said direct trauma. So trauma to this area of the nose, yes, it could result in that kind of epistaxis. And as we said, this patient was playing football in a dry season. It therefore tells you that even dry air could potentially cause this epistaxis. That is also very important that we look at. So these are the important things which, of course, as far as this patient is concerned, we need to look at. But understand that because this patient's platelet count was low, and that was why the initial management really did not really go well. And so what are the initial management steps that we want to see? So the first thing is that whenever you have, say, a patient, the patient should be placed in an upright position. That's the first management step that we need to. You shouldn't bow the head down and all that. It should be in an upright position. Now it shouldn't turn backward, because the blood will also get in there, cause some kind of asphyxiation. We don't want to also aspiration, actually. We don't want to actually cause any of those things. So the person should be in an upright position. That's the first initial management step we need to employ. Then we need to also apply some kind of pressure to, of course, the alley of the nose. So there's the ala, the wing of the nose. We need to apply pressure over there, trying to cause some kind of activation of the platelet, helping to, of course, stop the flow. And of course, some cold compressions will also, be applicable over here. These are the initial management steps that we need to, employ. Now, the next question that I will need to ask is that what will be the complications if, for instance, we don't manage this, situation very well? And my friends, your complications will be that the first one, it could result in some kind of anemia, so to speak, because if you lose a lot of blood, of course, your red blood cells will be losing a lot of these things. They contain the hemoglobin, so at the end of the day, your hemoglobin level may go down. That's the first thing. And then if that is the case, there could be something you call even hypovolemic shock. It could take place if you bleed a lot. Okay, a lot of your blood comes out. Then it could, some kind of hypovolemic, because the volume of your blood will reduce. It's also one of the complications, okay, in this case. And then also infection, yes, because the blood vessel has been ruptured, yes, if you don't take care, okay, all those infections, okay, they inhale there and all that, okay, maybe if you tie the nose, yes, there could be some kind of pathogens entering your bloodstream. So infection is also one of the complications if this thing is not well managed. And then my friends, as I told you, if the blood gets in there, there could be that kind of aspiration of the blood, and we don't want that. These are some important complications that we need to actually look at. Okay, so this is what I have for you as far as looking at a case study on bleeding through the nose is concerned, epistaxis. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.